Hello, you're very welcome to the nutrition demonstration for the Living Well with and Beyond Cancer conference for the Irish Cancer Society. My name is Ruth Kilcawley. I'm an oncology dietitian in the University College Hospital, Galway.
And my name is Edel Barrett, and I'm an oncology dietitian in the University Hospital, Galway also.
We thought we would start the demonstration today by showing, I suppose, a main course meal that I would cook for my family, and ways perhaps that I've changed that recipe to fall in line with the preventing cancer guidelines, which were also very relevant in survivorship as well. Firstly, here in front of me, this dish would normally contain chicken fillets, and like any mom with growing children, I would normally have, say, one chicken fillet per family member. However, the guidelines recommend that we reduce our intake of meat overall, and also processed meat. So you can see here I'm in a little bit of trouble because I would always have used chorizo in the dish to give it flavor. So today I'm reducing my chicken portion size down to 500 grams for a family of 5. But I am adding in chickpeas instead of the chorizo, and I'm going to use some smoked paprika with that so that we get the similar type of flavor. So we'll just get started here on cooking the chicken. So with this dish, like any dish you would have, you might be in a hurry, and so it's handy to have a dish that cooks in around a half an hour. So hopefully by the end of this demonstration, I'll be able to show you the cooked dish. Edel, how would you find Living Well Cancer?
So I suppose this presentation is about eating well after a cancer diagnosis, and I suppose that can be during your treatment or for afterwards. And I work in radiotherapy in the hospital in Galway, and a lot of my patients, you know, obviously it's very important for them to eat well and maintain their weight during treatment. As we know, weight loss can reduce overall survival and cause poor tolerance to treatment, you know, and poor quality of life.
Yeah. Regardless of any stage of your cancer journey, or whether you're going through treatment, or if you've been on treatment for many years, having a good variety of brightly coloured fruit and vegetables is so important, because they all contain different antioxidants. And so having the variety through making sure the colours are different is a really good way of ensuring you're getting a wide, varied fruit and vegetable intake. And, you know, there's very few guidelines in that, isn't there, that wouldn't be that wouldn't be part of. So that's why I suppose in most of my dishes I'd always have peppers, courgettes, and even onions as good varied vegetables.
And if your appetite is poor as well, which can be a side effect of cancer or even cancer treatment, I think if food looks more appealing, it can be easier sometimes to eat it.
Yeah, certainly.
So loads of colours.
Certainly. So what you can see here at this point is I have the chicken. The chicken is cooking up there, and so rather than the chorizo, which I can't have, I'm going to add in the paprika with the chickpeas, and the paprika gives the chickpeas a lovely red color. So I suppose you'd call this like a cheese chorizo. Protein foods come in a variety of types. So this protein food here is plant-based. So again, that ties in with the guidelines around increasing our plant-based dietary sources. And chickpeas, lentils, peas, beans in general are all really good high-protein plant sources. So today I'm using chickpeas, and oftentimes people would say to me, you know, I'm just not really sure about how to cook them. So over here, these are 3 different examples that I would have of pulses that are available, just so you can see there, pulses that are available at the shop counter. And so any of these will work in line with reducing your meat content. So even if you're using, say, mince in like a chili con carne or maybe spaghetti bolognese, you can reduce your mince intake, add in lentils instead, or half and half. And similar with any of the beans, it's a great way of reducing down the meat and upping the plant-based protein in your dish.
It's also a really good form of fiber. Again, going through treatment, especially radiotherapy, I find a lot of my patients, or a high proportion, can be, you know, find it difficult to go to the toilet. So usually because of the pain medications, which are vital. So getting your fiber in plus loads of fluids is really important.
Exactly. Yeah.
So I see there, Ruth, you have paprika, obviously to enhance the taste.
Yeah.
Which is great. Again, when you're going through treatment, sometimes a side effect can be taste changes or no taste whatsoever. So in that case, a dish like this would be perfect. On the other side of that, sometimes patients can have sore mouths and sore swallows, and you know, spices might aggravate them. So if I was making this dish for my patient group, a patient, say, with throat cancer, sore swallow, I might add less or no paprika and more kind of tomato-based sauces on its own without the spices and the chili.
Yeah, and taste changes happen in every form of treatment, really, from chemotherapy through to radiotherapy. So again, some very handy supermarket tips for that are these. I think these are great. These are little flavors that you can keep in the fridge. It means there's very little preparation time in adding flavor, and also you can change it for family members. So where somebody with cancer may not have a strong taste, at sometimes they might want a little bit more flavor, like more chili or more ginger. The rest of the family members might need less. So these are great for individualizing the strength of flavors that people might have. So in this dish here, I'm going to use a little bit of the herbs. I'm also going to use a little bit of the garlic. I also like this because your fingers don't get covered in garlic, which is great. And I'm going to add in the vegetables to this dish now. Vegetables need a little bit less time to cook, which is great, and it maintains the kind of, you know, the health benefits of the vegetables if you don't overcook them. So here we go.
You've ginger there as well, Ruth.
I have ginger, yeah. I brought ginger because, you know, some of my patients really find ginger very useful if they're feeling nauseous. And so ginger can be added to a range of different foods, but it's good in casseroles or curries, but also in things like smoothies as well. So the final then, I suppose, flavour for this is just a can of tomatoes, just to give a bit of moisture. And I leave that cook here for the rest of the demonstration. We'll see how it looks at the end. Just bring these over here. Edel, you're going to do something for us today, are you?
Yes, yeah. I'll just shove all my ingredients in. So what I'm going to do today is make a high-calorie, high-protein smoothie. Well, two of them, actually. And this can be useful for any patient undergoing radiotherapy, chemotherapy, where their appetite is poor, you know, and it can be often difficult to maintain weight and muscle mass. So first smoothie I'm going to make is a peanut butter and oatmeal smoothie. So again, high in calories, which is good. Banana is included in this as well. Sorry, that's probably the main ingredient. So first of all, I have no knife here in front of me, so I'm just going to sure. I can just break the banana.
Here you go.
Wash my hands. So I'm going to add a banana. I'm now going to add, depending on how thick you want your smoothie, you can add either about 200 ml of milk or a cup of milk, which is around 240. So I'm going to add 200 ml. Now this is full fat milk. The reason I'm choosing full fat is obviously it's higher in calories. It's very hard to read this upside down. and it's a good source of protein. Protein is really important, you know, to maintain muscle mass. And a good way of getting it is drinking it, obviously. I'm going to add maybe 125 grams or half a cup of Greek yogurt. Again, Greek yogurt is really high in protein. I'm choosing the fuller fat variety, obviously to get the calories in there. It's probably a bit much, but anyway, it's fine.
I think with the people often say, why so much protein in, you know, when we're living with cancer, and one of the struggles that I suppose people with cancer have is to prevent the muscle wasting that sometimes occurs with different types of cancer. And so, like, there you have your milk and also the Greek yogurt, two excellent sources of protein, and also the
whey protein, which I have here in another smoothie. That's an excellent source of protein. There's about 20 grams in a scoop. If you don't like the idea of whey, you can also get Marvel or skim milk powder. You can add 3 tablespoons of that to smoothie, and that's a good, or your milk, or any kind of milky dessert, and that's a good way of upping your protein. I'm going to add 2 tablespoons of oats. Oats are a good form of fiber, and they also provide energy, especially, if you're struggling with your meals. What am I going to add then? I'm going to add 2 tablespoons of peanut butter. Peanut butter is a fat source. I'm choosing peanut butter over, I suppose, butter, or well, not that you'd add that to a smoothie, but it's a good form of fat. It's your good fats, your monounsaturated fats, which are good for your heart. So I'm adding about 2 tablespoons there of that.
I often think people with swallowing difficulties miss out on nuts, because if you don't, if you're not able to chew food adequately, normally nuts are one of the things that you won't have very much of in your diet. So it's great to see nut butters on the shelves more, because you get the nutritional value of the nuts, but if the texture doesn't suit, it's a very handy way of getting it in.
Now, so I think that's everything for that smoothie. Also, I meant to say, the nut butter, where's the lid of this? It's also high in salt, so again, if you have any taste changes or poor taste sensations, it can, it's easier taste, it's nicer taste. So we'll blitz that up. And just to say, it doesn't have to be this kind of blender, it can be any kind of blender, A hand blender even is perfect. Okay, so if you have a loved one at home, this is a lovely high calorie, high protein smoothie. And there's about 2 portions in this. So that's one. The other one, you'd be thankful to know, I kind of put together earlier. So this is high calorie and high protein as well. Again, I used full fat milk for the protein source. I added a scoop of whey protein to this one, but as I said, you can add, skim milk powder if you want. I actually added, well, I didn't add, I will towards the end, I'll add milled linseed. This is, again, a really good source of fiber, and a lot of cancer patients going through treatment can experience constipation, so that can really help. Obviously, if you were experiencing the opposite, you would stay away from something like that. I also added about a handful of strawberries, handful of raspberries, half an avocado, again, a good source of good fat for the diet, and the fruit can be quite refreshing if you're having, horrible taste in your mouth. A tablespoon of maple syrup, which I added to the other one there. Sorry, I don't think I mentioned that. Again, just to make it taste nice.
I think that's so important, because if you can have all the goodness of the world in a smoothie, but if it doesn't actually taste nice, then it's not going to be drank.
You're not going to drink it. And this is why it's nice when you make it fresh. It can be more appealing. And I also added a little bit of mint as well, because if you have a sore mouth, which can happen during treatment as well, it can be quite cooling for your mouth.
Does it help with your tummy as well? I suppose
can help with
people
your
would
tummy.
say that, wouldn't they?
Yeah. So I'm just going to blitz that up. It's probably a little bit of a mixture of the other smoothie and the lid of it. Now,
that looks lovely, lovely bright colour from it, isn't there?
Pink.
Yeah. Well, you eat with your eyes, isn't that what they say?
And you can change the color too if you want it more blue, or you can put any fruit you want in. You can put blueberries in, you know.
Our blackberries are
Or
really good this time of
blackberries,
year as well, yeah.
They're more seasonal.
Yeah.
So there you go.
Very nice. And when do you think people should have smoothies like that? Is there a particular time of the day that's good, or?
I think it's good to try your meals,
Yeah.
you know, so not to be full up during mealtime. So I wouldn't have it directly before or around the mealtime, but maybe in between meals is a good time, or before bed, or even, you know, as you're waiting for your treatment, you could put a bit in a bottle, you know, because I often find treatment can play, you know, interrupt your meal times a bit. So it's good to always bring a snack or something high calorie with you.
Yeah.
So I'll bring these out of the way.
So we've looked at snacks, and we've also looked at you know, a main course, which is cooking away here, and it looks great. I thought another thing that might be useful for people to focus on maybe is breakfast, and breakfast can be a challenge to, I suppose, get something quick and healthy. So today I'm just going to show you a very quick granola, and again, this is one that I make every Sunday night. So I really need something that's pretty quick that'll feed the family, and so I tend to just to go with packets of things. So here in this granola, I think the basis of all granola really is, first of all, a good variety of seeds and nuts. So what we have here is pumpkin seeds and sunflower seeds here in the one pack, very handy. I go with the mixed nuts, a pack of mixed nuts, and again, sometimes at home I might have, you know, a pack of Brazil nuts and another pack of pecans and walnuts, but for today we're going with one size fits all version. So again, I like these kind of chunky and whole, but other people would prefer if they're a little bit more chopped up. But either way, they go in there pretty quickly into the bowl. From a fruit perspective, mixed berries are good, mixed as in mixed sultanas and raisins, so dried berries. But also sometimes I'd use maybe apricot and mango are a good combination of dried fruit as well. And the dried fruit's great because it just adds a bit of sweetness. So I put in the mixed fruit in there. Kind of, that's a bit of a big pack, so I'll only really use half of that pack. So then kind of mix these up. At this point then, it's about preference. So I use jumbo oats, and the amount of oats that you'd use in granola depends on, I suppose, how active you are, what your preference is. I like the jumbo oats because they stick well during the cooking process. So throw in oats there, and again, you're just kind of looking to see how much oats you like yourself in it. So that's a kind of nice amount there.
I like that there, the way Ruth doesn't measure anything, you know, she just throws it in, which is good, because you sometimes can be worried about being really exact when actually just throw it all in.
I think, like, sometimes people think if I have to pull a recipe out, it'll take me too long. So, you know, this, I suppose, getting used to just doing things by the pack means that you'll get it done. And I suppose the big benefit is that your homemade granola, you determine how much sugar is in there, you determine how much fat, and also what kind of nuts, etc. you choose. So it's always going to be a higher quality from a nutritional perspective, and also lower sugar and even lower salt. For my fat source, I'm using coconut oil. So I've put a bit of coconut oil in there again. And really, I suppose with fats, as what we've discussed, there's such a wide variety of fat sources. So the trick is to get as many different fat sources. But obviously, reducing your saturated fat is important for long-term cardiovascular disease prevention. So I'm putting in just that much of the coconut. I'm using maple syrup, but in fairness, I often just use a local honey. So there's a guy who makes honey out in Athenry. I tend to use his a lot. So that's perfect on the maple syrup. And then I like to flavour it with a small little bit of vanilla. So I'll just pop this into the microwave. Edel sees me, I eat this in work.
Yeah, no, I'm actually watching, so I can do it myself. I think it was you give me some to bring home. It looks lovely. So she normally what do you normally have with it, Ruth?
Oh, the Greek yogurt and berries. I have some here. And I suppose like that, it's about finding a way of bringing food to work with you that's very healthy. So I have them in little containers where I keep the yogurt separate from the fruit, and also from the granola, so they only mix together, you know, at coffee time, which is great. It does make me think a lot of people who are going through chemotherapy and treatment at the moment, they have to bring food with them to the hospital. There isn't the same access when, you know, people are trying to limit their contacts. And so making up these and having something like this with you going through treatment is a great way of staying nourished for the day, having little snacks like this, you know. So here we go.
I find sometimes my patients, they can't go to the shop, you know, they're trying to cocoon and they would miss a meal, so it would be good to have.
So there's the little mix there. So pop that in and give it a good mix around. There, yeah, it is hard. It is hard with the not being able to go to shops. So preparation is everything. So take out your tin and you pop this in here. And we make this on Sunday night, and so our house always smells the same on Sunday night, which is this delicious smell of honey and vanilla and coconut. So that's it there.
And the thing about granola is you can eat it any time in the day, really. You could have it for your breakfast. You could have it as a snack, as a dessert.
Yeah.
Or before bed. You know, it's quite filling.
Yeah. So that's it there. So we pop that into the oven for, I'll take those out of the way there. We pop that into the oven there. I put it in at around 150 degrees for around 45 minutes, checking it and stirring it all the time. Oh, sugar. Oh, there we go. Pop that in there. And this is one I made earlier. Had to say that. And so this is the granola that I made, I suppose, this week. So what you can see there is that it's nice and toasted. You can see the combination. This one here I used trail mix as the flavoring. So there's little bits of coconut in there and banana and the nuts and seeds. And so it's an excellent way of keeping your energy levels up during treatment.
Yeah. And you know, as Ruth said before, you can determine the amount of fat or sugar you put into it. So if you're a patient undergoing treatment, struggling to eat, getting your calories in, you could always have more nuts, more coconut oil, more maple syrup, more oats, you know.
Yeah, and the opposite is true as well. If you're trying to lose weight, then you can limit those and you can put in a little bit more seeds and those kind of foods.
Yeah.
So serving up then some of the things that we've made, Edel. So for the breakfast, what I would serve up there is the granola with the Greek yogurt and a mixture of fruit. That's a good high fiber, lots of seeds in there, nuts, and also your high protein yogurt and your berries. Edel, you there then?
Plain and simple, 2 glasses of smoothies, but you can also, I suppose, as Ruth said, you can bring them on the go. You know, you can put them in little containers, little bottles, and have them, you know, during your treatment, or, you know, even if you're post-treatment survivorship, you know, you can always use low-fat milk or whatever and reduce the calories that way.
Yeah.
Up the berries. Yeah.
And then for the main course then, again, the goal was to show you that there are alternatives to high amounts of meat in your dinners, reducing the content of meat by upping the amount of lentils or chickpeas or beans, using flavoring to overcome any taste issues or problems, and keeping a good high amount of fruit and vegetables of a variety of colours is a good way of getting all the guidelines in. Serving the main course, I'd often serve it with rice, and again, I would be a big fan of basmati rice, but I suppose a good alternative is whole grain, higher fibre variety of rice, which again ties in with the World Cancer Research Fund guidelines on prevention of cancer, and they're also applicable for survivorship in the sense of keeping up your fruit and veg intake and plant-based sources. So similarly, if you are later in beyond cancer treatment and you're looking for I suppose other ways of balancing out your meal, reducing down your carbohydrate sources can be useful if you're trying to lose weight, and upping things like, for example, serving it with extra lettuce and greens, and maybe adding in extra chickpeas there for energy as well. Or sometimes, again, in a busy life, you might have a portion of this for your dinner and the next day have a similar portion with the salad for your lunch. We're coming to the end of our cookery demonstration, and I hope that you found it useful, as maybe get some tips on how to eat well, both during and beyond treatment, and we hope that you enjoyed the rest of the conference.
Great. Hi, everybody. I'm Rob I'm the Director of Research in the Irish Cancer Society, and I'm joined by Ruth there after that fabulous video that Edel. Oh, there's Edel coming in now as well. We've got the full team. So joined now by Ruth and Edel. And firstly, I want to express my appreciation, as I did yesterday as well. This is the second time we've run this slot because it's always one that attracts a lot of attention. So really grateful, guys. Fabulous video. And didn't they look really natural? I think they've got a talent. Hopefully they'll stay in oncology, but if they don't, they'll certainly get on to breakfast TV or that with the recipes, and that really natural in that. They make it look very easy. We also want to express our sincere appreciation to Galway Mayo Institute of Technology. They made the facilities available for the guys to record the video. We have questions. It's open there, and we're already getting thanks there, I see, from Elaine. A great demo. We're open for questions there. I'm going to start going through the first of them there, but please just stick them in. And guys, I'd love to hear questions. And if you don't ask them, I'm going to have to make some up. So do feel free, and don't feel shy. We don't know who you are or where you're from, so it's all anonymous. So the first question, this was one that came up as well yesterday, and I suppose both of your recipes focused a little bit on getting fiber into the diet, which for someone who doesn't have gut issues and that would be important, certainly in the longer term. But obviously some people can have conditions like colitis, or they can have maybe an operation on their bowel, and they might be a bit more sensitive to fiber in their diet, make them uncomfortable. So what would you suggest, maybe modifications that maybe keep with the healthy theme and the easy theme, but maybe make account for their sensitivities to fiber? Ruth, we have you unfortunately on mute. Edel, maybe while we unmute Ruth.
Ruth's not allowed to talk today. Yeah, so that's really common for patients who've undergone a gastro surgery or have a condition like colitis, for not to be able to tolerate fiber, either, immediately post-surgery or for quite a long time. And vegetables, whole grains, fruits, they may cause, upset, GI upset, gastrointestinal upset. So what you could do is you could maybe reduce the amount of vegetables in, like, say, Ruth's dish. The beans, very poorly tolerated. They're really high in fiber if you're having issues with digestion that way. And upping maybe your carbohydrate, like your white rice rather than your brown rice. Or even just reducing the amount of vegetables. We know it's really important to retry fiber after every 6 weeks or so, because when you have surgery, you may find your tolerance to fiber may improve as time goes on, or not, depending. So that's really important. Same thing with the smoothie, maybe reduce the amount of fruit in the smoothie, but still include your high calorie fats, the proteins, and energy sources to get the calories in.
Can you hear me now?
Can hear you great, Ruth. Yep.
Great. Also, I do think on what Edel was saying, that fiber is one umbrella term for many components that are in food, and even looking at fiber from a point of view of soluble versus insoluble fiber can help people to be able to choose foods that are still healthy for their bowel but may not create the same level of bulk or problems with digestion or even wind that some people go through following
bowel surgery. So for example, some people may require like a low residue type diet for a couple of weeks post-surgery, and then the slow introduction of fiber is important, but something, because people are now at home, it's something that people sometimes don't transition through to a good level of fiber again. So we would often say, you know, on the carbohydrate level of going from, say, a ready break through to a full jumbo oat porridge is an example of being able to build up your tolerance to fiber again. And equally, blending down vegetables into a much smoother consistency is sometimes tolerable for people. So in that kind of a recipe, you know, cooking off the onions and the peppers and the courgettes, but then blending them down to a much more blended consistency and adding them back in as a sauce can give you the same antioxidants, a similar taste, but not have the kind of indigestible components. Also, root vegetables tend to be tolerated better for most people if they have bowel issues. So, you know, things like carrots and parsnips blended down and cooked well, and then moving towards kind of a more indigestible form as the bowel recovers is important.
Some really great tips there, and thanks very much for the question from Fiona. Hopefully that gave you some pointers there. I think Richard is really interested in getting the recipe, so I've been talking offline to Breda, who's been coordinating all, so she might get in contact if that was okay with Ruth and Edel and get that. And what we'll do is we'll just put it up as folks hopefully are aware. These videos will be going up at the end of the week, so they'll be accessible to anybody who wants to get them, and we'll put the links into the recipes there. And I think that'd be a great help, because you guys made it look so easy, but even just when I go out to the shop, I might want to get, you know, a list together and that. So it'd be great if we could put those up after. So hopefully that's useful for you, Richard. And I think you've asked on behalf of lots of us who'd love to get those recipes. Caroline is asking, again, I think a really important one, impacts a lot of people who've been through breast and prostate treatment in particular. So after the treatment, sometimes we can have a tendency, especially if treatment is ongoing with some of the steroid agents and that, we can have a tendency to put weight on. And I suppose we're all getting a little bit older in that as well, and different things can be going on in our lives. So any thoughts or suggestions there for dealing with that weight gain and, you know, from a nutritional perspective?
Do you want to take that, Ruth?
Yeah, I can start and you can continue.
Okay.
Yeah, so I suppose it's very conflicting messages when people are going through treatment, and particularly chemotherapy and radiotherapy. We focus a lot on the preservation of lean mass and preventing unintentional weight loss during treatment, because we know that's linked to better outcomes and survival. But then following treatment, the emphasis then turns to prevention of recurrence, and I suppose also prevention of chronic disease, because sometimes that is linked with certain types of cancers later on in life. Particularly, there's an association between cardiovascular disease and breast cancer. And so from that perspective, weight management is really important. And indeed, the World Cancer Research Fund are very clear. They recommend that, you know, you should really be a healthy weight, but actually be as lean as you can. So this is a time in your life when a lot of people tend to gain weight. You've been through, you know, treatment, and yet the recommendations are be as lean as you can. So we understand that that's very challenging. Some of the advice that I would have is, first of all, ensure that you're in an energy balanced situation, so that you're expending the same amount of energy that you're taking in every day. And that means that exercise levels need to be up at, you know, 60 minutes of moderate intensity exercise up to 5 times a week to ensure that you're expending the energy. And then also from a dietary perspective, portion control is really important, in the sense of just making sure your portions of energy dense foods such as protein and also foods like carbohydrate are small, are to your requirements. Also, as well as that, just making sure that your treat foods, I suppose, are down to a low level, that, you know, you're having treats at, you know, once a week, and not dipping into treats throughout the day, things like biscuits and those kind of foods. one of the, like when we look at managing weight, I suppose monitoring weight is an important part of that. So, you know, monitoring your weight and recording your weight on a weekly or 2 weekly or monthly basis can be very helpful in people understanding or realizing, am I doing enough to keep my weight in check? And also being able to congratulate yourself for having tried hard and having seen the benefits. So some people use the scales, other people where they find their weight is going on around their middle, using a waist measure and recording what the waist measure is over the course of a month or 2 months when you're trying to reduce your weight is really important, because it is where weight is stored that's important as well. If you're storing fat around your middle, that puts you more at risk, and so therefore, you know, monitoring that is important. Have you anything to add, Edel?
No, you've covered all the dietetics of it. I suppose I'm thinking of behavior change, and you said it there, Ruth, kind of praising yourself if you do lose weight, but also relapse prevention. If you do slip up and you do, you know, have that karma, you know, don't think, oh, well, I've done it now and that's it, and I'm going to put on a load of weight and choose all the wrong foods, but to just go back on again and restart and make all the right choices going forward.
So some really great advice there, and I suppose it's coming across that there's kind of a number of different factors. So there's the foods that you choose, there's the portion size, there's the exercise to take the energy out that you're putting into your food, and there's that behavioral thing. And I think maybe what Edel is saying as well is kind of be kind to yourself. You've been through a difficult journey. You're not going to get everything right every day. And don't let it get in on you a little bit as well, because I think the psychology can be quite important, particularly over the longer term. And hopefully your treatment is giving you a long and cancer-free life after that. So we've kind of so thanks for that question, Caroline. Really appreciate that. We've kind of a converse question then. One that I have to say I haven't seen that often myself, but so from Elaine, and she says about struggling with weight gain during chemo for breast cancer. So any thoughts in that one, and is that one that would be common?
Ruth answered this really well yesterday. I don't mind saying a little bit, but be common with breast cancer, because a lot of patients undergoing treatment for breast cancer are also getting hormonal therapy as well, and that can cause weight gain and issues with insulin resistance and gaining weight around your middle. So again, as Ruth said, just with the weight, maintaining your weight, you know, be careful with portion sizes of carbohydrates, you know, portion control, getting sufficient physical activity, including lean protein, upping your fruit and vegetables and whole grains to fill up on are the main points. Ruth, if you want to say any more there.
Again, I'm kind of acting, I suppose, as Edel did there, that actually some people, I do a group with people starting treatment, and oftentimes some people can eat and when they're anxious, you know, there is that component around, you know, if you find that one of the ways that you deal with stress or anxiety is that you tend to eat a little bit more, then it's important to watch out for that. Other people are the opposite, they don't eat, and that can be a problem as well, particularly around diagnosis and early treatment. So just again to I suppose watch for that, and I'd often say there's no problem with eating foods that are higher in fat or confectionery or foods, as long as you've covered your bases, as long as you have the healthy eating foods in first, that you're eating enough dairy and you're eating enough fruit and vegetables, and then certainly there's always room for a treat. But you know, I suppose just to be careful on the amount of times or the types of foods that you're eating that maybe don't confer the same health benefits.
Okay, thanks very much for that, Elaine. Great question again, and hopefully that addressed your query. We've a few more minutes for questions, so please do put them in. I just wanted to kind of follow on from one of the themes that's kind of coming across there. I suppose lots of people think of cancer and diet as a sort of a singular thing. So in other words, the advice refers to every person with every type of cancer at every stage, you know, from diagnosis right through to recovery. And I guess I've learned gradually and from interacting with yourselves and that actually cancer probably needs to be broken down into lots of different sort of subgroups. And so the advice, and I think it was Edel hinted at this earlier, the advice that you might give during treatment and for particular types of cancer, it might seem actually quite different to the advice you might give to somebody outside treatment or somebody who's maybe a bit older. Ruth, maybe I might kick off with you. I don't know, would you agree with that? Have you any thoughts and maybe how people can try and work out the advice that's relevant for them and of use to them?
Oh yeah, absolutely. I suppose we're acute dietitians, so when working in a hospital setting, we're looking at trying to provide people with cancer with their nutritional requirements at very difficult stages in their treatment. But you know, for that doesn't apply to every person with cancer. Different types of cancers, depending on the tumor location, or the stage of the disease, or the type of treatment that they're going under, is going to affect their nutritional status in a different way. So, for example, cancers of the GI tract and the lung are associated with unintentional weight loss. That can be through reduced appetite or reduced absorption or assimilation of nutrition or an increased requirement. But other cancers are less associated with that during treatment. So, for example, with breast cancer and prostate cancer, they're not so much linked with unintentional weight loss. And indeed, for many people, losing weight in an intentional way over the course of a couple of months or years can benefit people in their life and in their recovery as well. So it's very much an individualized I suppose, approach and changes at different stages of people's treatment. How people will know what's good for them, I suppose, firstly, is that bit of being aware of the nutrition impact symptoms of the disease or of the treatment. So is there something going on that's affecting your dietary intake? Do you have nausea, constipation, or do you have just a lack of appetite? You know, just do not feel like eating. And they're warning signs that you may not be able to get in the right amount of food and you may get weaker. However, if you don't have a high number of symptoms like that and you're eating well, then the advice would be to follow a healthy, varied, balanced diet, and if appropriate, over a long period of time to lose weight, as we'd recommend the general population. For that reason, dietitians you'll find who work in cancer always veer away from a one-size-fits-all approach to cancer nutrition. You know, everybody needs to eat this or everybody doesn't need to eat that. It's totally inappropriate, because sometimes what you eat is going to affect your treatment in a positive way, or the opposite is true. If you're avoiding food or if you're restricting food when you're at risk of malnutrition, that may work against your treatment. So I suppose it's about being individual, and it's also about seeking the support of your wider medical oncology team. You know, I was reading just one of our studies there from 2018 when we looked at the patient experience, which is very much the theme of the conference today. And the patient experience from a point of view of nutrition is 90% of Irish patients going through cancer treatment, they rate nutritional intake as extremely or very important to their overall goals. So, you know, that everybody really does realize it is important, but it's individual to themselves as well.
Any additional thoughts there yourself, Edel, about, I suppose, this the individualization and the fact that cancer isn't a catch-all term at different stages, diagnosis, treatment, and afterwards, the advice may need to be individual?
Yeah, sorry, you broke up a bit there, Robert, but I think I got what you said. No, absolutely, like you said about the bowel fiber, you know, that's individualized there about nutrition impact symptoms. For example, if going through radiotherapy or chemotherapy, often
we're just losing
down their symptoms. So in that case,
yeah, we're just having some connection problems there. Yeah, you're back now. Yeah. We might just move on then, because we've maybe 5 more minutes. We have a couple of questions there in as well. So I'm not sure if this one might need specific advice from a professional in the background, but there's a question in here from Laura about her daughter who's had treatment as a baby, and I guess there's some issues around weight gain now as a teenager. And I suppose teenage years there can be big transitions, and weight is one of those. But is that something that you guys are comfortable with, or would you suggest a specific consult with somebody?
Oh, absolutely. I think that there are a number of factors that may be going on, you know, with that patient. Certainly, a girl going through adolescence, weight gain is a normal, natural part of the process. But it sounds, from an experience from that maybe she does need to seek the advice of her team for those latent after effects of treatment many years later after childhood cancer. It's not an area that I would be competent to discuss, really.
Okay, Maura, hopefully that gives you some sense there of things that you might be able to do. One from Sandra, and I guess this is kind of getting us into some of the advice and the misadvice that people can come across in this space, and it's amazing actually how many different aspects of things people can pick up from Facebook and YouTube and so on. So Sandra asks, what's your opinion of having sugar in your diet? Should I avoid it? Also, told that apple cider vinegar and flaxseed oil is a good daily drink. So your views and thoughts on that as professionals in the field.
Well, this came up yesterday, and like as I said, there's so many myths around diet and cancer, and there's so much on Google, and you have to be careful about where you get your information from, and if it's a reliable resource or not. We do know that there's no evidence to say sugar feeds the cancer. You know, all our cells live off glucose, sugar, even cancer cells, and even if we don't eat sugar, we're going to find it in our body. Our body's going to make it through protein and fat. You know, and certainly taking sugar out of your diet, we know sugar comes in two forms. It's added sugar and natural sugars, so your table sugar, your honey, or your fruit, vegetables, dairy. You know, and it can also come in, you know, in your whole grains as well. And if you start restricting your diet and taking things out of your diet, you can actually do more harm than good, end up losing weight, losing, you know, lean mass, which we know is important for survival and response to treatment. So certainly, I wouldn't recommend reducing carbohydrates. You know, if anything, maybe look at added sugars and reducing them in the day, such as your fizzy drinks, your table sugar, etc. That would be the most reliable thing, but it's not feeding cancer.
Ruth, do you want to come in there and maybe deal with the vinegar and the seed oil?
Yeah, exactly. I suppose I suppose it's really good to bring up these questions, because you know this is so important for us to be given the opportunity to help patients in the sense that people are really motivated to help themselves during cancer treatment. And it is a time when people often feel, and people would report to me that a lot of decisions are being made around them, you know, and they're engaged and want to help themselves in the treatment, and they want to do what they can. And the basis for that is eating a wide, varied diet based on the foods that we discussed in the video. And if anything, increasing lean protein intake a little bit will help, because that can help preserve lean mass. But after that point, unfortunately, there is no evidence that the vast majority of dietary factors such as flaxseed or vinegar or you know, different herbs or spices are going to have any kind of a magic bullet effect, because nutrition is extremely complex. And to be honest, eating a wide varied diet with that bit of extra protein in there is actually really challenging if you're going through chemotherapy or radiotherapy, if you're in pain, if you have no appetite, if you're struggling from constipation. So I think focusing on the basics, getting them right, is such a challenge in its own right, that people, I suppose, to do that, you know, need to be given the space to do that and the support. And suggesting additional factors that aren't based on evidence is, I suppose, putting a lot on people going through cancer that you know will not give them any benefit. So it's something that I think we see every day, and that I know that people are find challenging. Is the messages, oh, if you do this, this is good. If you do that, this is good. The goal is weight preservation, stabilization of weight, prevention of unintentional weight loss. And the goal is really enjoying the quality of life that you have and achieving all your nutritional goals through a healthy diet throughout your treatment and beyond.
Sure, and I might, maybe in the last minute that we have now, we had mentioned yesterday of dairy and I suppose milk and milk-related products, which I think comes into that kind of category of things that people worry about as well. Would you have maybe any concluding thoughts on that as we wrap up? And maybe people have heard that they shouldn't be taking dairy or avoiding dairy or that. So any thoughts on that?
So we talked about this yesterday as well. There's no evidence that dairy is harmful, you know, in terms of promoting cancer. It's a really good source of protein, you know, and it can help preserve lean body mass, which again, we know is really important. To be fair, there are people that might have lactose intolerance, you know, because of IBS or maybe because of Crohn's disease and other issues. And for a short period of time, you know, removing maybe lactose in your diet may be beneficial. Again, it's important to retry it after 6 weeks, but again, dairy is a really good source of protein, good source of calcium in the diet, and it's not bad. Ruth, what do you think?
Yeah, excellent source of animal protein, so really good. But like that, I think Edel's just described, the one size fits all doesn't really come in. If you're struggling with radiation enteritis, removing lactose from the diet for a short amount of time, like that's the sugar in milk, may actually help relieve your symptoms, but it would be brought back in. But for the vast majority of people, dairy products are, and they're a good nutritious source. And I suppose when we look at the long-term effects of, you know, trying to reduce our red meat intake and processed meat intake, in reducing them, adding in additional low-fat or naturally lower-fat dairy products can be a good option in getting the protein in a balanced diet. Yeah.
Okay, well, the guys are going to kick us off here, and I'll get into all kinds of trouble if we go on any longer. So I'll wrap up here now. I'm really grateful for the engagement for all the people there, the great questions. Hopefully got some benefit. And again, just to say thanks so much to Edel and Ruth. A huge amount of preparation went into this. I think you could see it in the video. The guys are real experts. And I suppose if you have a query about nutrition and diet with any illness, you really need to try and reach out to your dietitian and get expert advice. There's so many people there who really don't know what they're talking about, and ultimately could have a longer term negative impact on your health. So always speak to an expert if you can. Thanks again to everybody, and looking forward to chatting again soon. Bye now.
Bye, Robert. Bye-bye. Thank you.